touched on earlier, and one of the most common things I hear is bariatric surgery is the easy way out. And nothing can be farther from the truth. Because to be successful after bariatric surgery requires changing your mindset, changing how your relationship with food, changing how your interactions are with yourself and with other people. And lastly, it's the actual surgery, and then recovery from the surgery, though not painful, still requires a lot of work. I tell people the first few weeks it's homework. You've got to maintain your nutrition and maintain your hydration, and you can't eat a lot over the first few weeks as the swelling from the surgery comes down. So the only way to get the goals we tell you to reach is by constant drinking and eating in small portions. So that's one of the biggest things. And so leading up to bariatric surgery is a difficult process. We want to make sure you're optimized and healthy for surgery, and so you do the best. And leading out of surgery, it's following the guidelines we provide to be successful. And often the most common thing I hear from patients who've done very well, whether it's a year later or 15 years later, and I'm like, "You're doing amazing. What did you do?" And they say, "Well, we did what you said." So they worked hard in the beginning to get their fluid in, to get their protein in, to boost their calories, to exercise every day, and that's the keys to success. Surgery by itself will do nothing.
I think also to what Dr. Antoine said, understanding the surgery as a treatment for a disease and expanding that knowledge into the public realm is actually very important, because getting treatment for your hypertension, is that cheating? Getting chemotherapy for a cancer, is that cheating? Well, is getting bariatric surgery to treat obesity cheating? Of course it's not cheating, it's a treatment for a disease.
I think this myth, harms a lot of people. This myth exists even on the medical level, even among some professionals, among family members, among people who actually give advice, but they're not in the situation. It's basically like me telling someone, you have diabetes, just stop eating and your diabetes will be better. Or stop eating sugars and your sugars will come down. It couldn't be further from the truth. It is not scientific. It's not based on any research or any data out there. It's us making a judgment on someone that the reason why they're overweight is because they eat too much. And if they eat less, then they're going to lose weight. It shows that we haven't studied anything when we say that. It shows that we don't understand the pathology that's going on. We don't understand the disease process. Not just because someone is overweight doesn't necessarily mean that they're just eating around the clock and eating junk all the time. Yes, they're sometimes doing bad habits and eating the wrong things. There's also a genetic, environmental, physiological process that goes inside the body that becomes very difficult to fight on our own. It's basically trying to control our physiology using our brain, which is something that's not easy, almost impossible in some instances. I always tell patients, when you gain about 50 pounds or more, it's almost impossible for you to lose it on your own unless you do drastic measures. And a lot of patients come and say that they've starved themselves for weeks to try to lose weight, and they lose a little bit of weight, but then they gain it back. So they're actually trying, they're actually doing their best to lose the weight. So the option when we tell them, just do it on your own, you can do it, this is the easy way out, don't cheat, is basically we're telling them, stay obese, don't fight, keep your disease, and then when you develop diabetes, hey, why don't you go for surgery? That is a wrong thinking in 2021, almost.
Some people who struggle with obesity are told that surgery is cheating, surgery is the easy way out. For certain patients, it's their only safe, effective way to treat this disease. Fewer than 2% of patients who have severe obesity can lose even 30 pounds and keep that off for 1 to 2 years without surgery. So when we keep hearing from patients and from even medical professionals that that patients just need to eat less and walk more, yes, that's true, but that's not enough for many patients. And when we have a surgical therapy that can empower diet and exercise to work better so that patients' metabolism and physiology will respond appropriately to diet and exercise, then we've armed our patients with a tool that can allow them to treat their disease themselves finally. Where previously all of those attempts at diet and exercise had been essentially negated by the metabolic abnormalities that come with obesity. And if we can try to reset some of these metabolic abnormalities so that when patients diet and exercise, they start to see the appropriate results. Now patients are empowered to take control of their health again.
I think it's really important that we, that we destigmatize bariatric surgery as the easy way out, because that is really creating barriers to patients getting, improving their health, getting the optimum treatment. For example, in someone who has diabetes, if they were on a medication they may need insulin, we would offer them insulin if they need it. And likewise, we know that bariatric surgery may be even more effective than any medication. Certainly in combination with medication is the best option to get people to treat and ultimately cure their diabetes. So seeing it as an easy way out is basically creating a barrier for people to get the best care and to potentially cure their diseases.
Going hand in hand with the perception of bariatrics as an easy way out, a lot of people sometimes have the idea that people who pursue bariatric options have a lack of willpower. And that's pointing the finger at the person who's actually suffering from the disease of obesity. A lot of people that I see, a lot of people that we see have struggled with obesity since they were children. They've had multiple attempts. So it's most definitely not a lack of willpower. It's most definitely not the easy way out. It's the body's normal physiology. It's different factors coming into play that add to the weight, which is causing the metabolic disease. And unfortunately, fortunately, flipping the script, bariatric is a way to interrupt that cycle.
And in fact, with the willpower, you could even argue that it's the people that have the most willpower, the people that seek out bariatric surgery and are able to put in that effort, to put in that work, because it takes a lot of work with diet and exercise, changing your lifestyle to kind of give you the best ultimate outcome.
I'm sure you can all corroborate this, but most of our patients know more about proper dieting and exercise than people who've never struggled with their weight, because they've been through this yo-yo effect where they've dieted and they've exercised and they've lost some weight, but with the metabolic abnormalities and the counter regulatory mechanisms, they regain the weight and then more because their metabolism just fights it. So these patients have gained and lost the same pounds over and over again, and in those patients, clearly diet and exercise are not enough. It's necessary, but it needs some assistance. That's where surgery comes into play.